much. Now we move on to another case presentation by Dr. Sonika Porwal.
We had a 28 young lady presented to our clinic with ocular discomfort. There was no other significant history. She had a family history of glaucoma. The rest of the ocular examinations were normal. The main important things were the IOP was 36 millimeters of mercury and 32 millimeters of mercury in the right and the left eye. And the fundus was normal. Disc was around 0.3 with a healthy rim. Glaucoma workup was normal. Diagnosis of ocular hypertension was made, very early GOI. So we started the treatment, started with anti-glaucoma medications. One glaucoma medication was good enough. 1 month the pressures came down to 18. After 3 months follow-up, the pressure started going up again around 28. After 1 month, adding one more glaucoma medication, it was 24. Adding one more, it was 20. So we thought something was not fitting into the puzzle. Something was wrong. So we started taking history again if she was using any other steroid by any means. She was using a fairness cream for her marks, okay, and then we found out what were the contents. It had mometasone and we had to stop it. So we decided to stop it and see. And initially we had her on AGM and then off this cream, and then off AGM and off cream the pressures came down to normal. It was a 1 year follow-up and she's doing well. So the pearl is young patients with ocular hypertension. She had a family history of glaucoma in the grandmother. So the glaucoma history strikes us, but such patients are steroid responders. Ask for history of cutaneous creams. They usually have used creams for marks which have steroids. Second case was a 50-year-old lady, came to our clinic with complaints of difficulty in near vision. Ocular examination was okay with the IOP of 25 millimeters of mercury and 26 in the right and the left eye respectively. Open angles. The disc finding was around 0.5 with the inferior equal to superior in the right eye and 0.6 with the IR notch in the left eye. Pachymetry was normal. Perimetry showed, though unreliable, it was a borderline GHT in the right eye with paracental scotomas and the left eye showed a superior arcuate. OCT showed superior thinning in the left eye. The twist in the plot was that she was using an antibiotic dexamethasone combination eye drops for 12 months. She was off the drops for 3 months. So she didn't feel that it was an important history, but our diagnosis of query steroid-induced glaucoma, query POAG was made. On AGM, her pressures were normal. We started the AGM for 1 year. Thought of stopping the steroids and seeing if the steroids were off for around now 1.5 years. Stop the AGM and see what she responds. She responded well. Without AGM, the pressures were normal. So the pearl here is steroid effect may last for around 6 months to 18 months of stopping the steroids. So try stopping the AGM and see if she's normal. If she's IOP is coming back, the disc and the perimeter remains the same. Diagnosis dilemma comes when the patient comes to you for the first time with a normal IOP with a disc suspect. Ask history of steroid use in the past. Look for any other features of NTG or document progression before coming to any diagnosis and starting the patient on lifelong treatment. Okay, this factor. Discuss.
Thank you, Dr. Sonika.
You have to really dig for steroid history. I recently had a cardiothoracic surgeon coming to me with intermittent blurring with halos and pressures of 50s. Dig. He had some itch on his hand, so he asked the dermatologist friend. He got mometasone again. He got his medical rep friend to give him loads of it. So it doesn't cost him anything. So every day half a tube was going on to his palms as cold cream. Okay.
Otherwise, it's difficult for him to do surgeries.
Yeah, that's what he attributed it to glove allergy and things like that. He found it very easy to continue his work.
Patients are Ayurvedic names. You would take the expectation that the Ayurvedic names they would contain steroids. And we know
here in Kerala, you have something called Pfizer cream. Pfizer cream, there's some natural beauty cream, so Ayurveda cream, I don't know. And they all come with, raised IOP.
Some Sanskrit names,
yeah,
make out for it.
Very difficult.
And another, I think we also need to
sensitize all our other physicians who give steroids for a longer course. Like patients, like the nephrologists, when most of the patients of renal transplant are always on maintenance steroids. Yeah, so the other physicians need to be sensitized that this is an entity and they only relate it to cataract. And they'll send you the referral also. Please check if there is cataract or not. Get anything else.
We recently had a patient who was using a heparin cream and she was bleeding from the trap ostium site. So every 15 days she'll come with a hyphema. We were also wondering why it is happening. Then we dug deeper, we found that she's using some heparin cream for acne.
That just tells us that the long old age-old dictum of take a good history stands true.
Actually, she made a statement relevant to the previous topic.
NTG.
So NTG, we should not diagnose without actually documenting progress till then you have to suspect.